A moment, we'll start our recording. All right, we welcome Tim, who will be speaking on Medicare today. Tim started as the SHIBA program manager in January 2021, and SHIBA celebrated their 45th anniversary last year. The program is part of the Consumer Protection Division of the Washington State Office of Insurance Commissioner. He's a big fan of the Medicare program, which was signed into law 60 years ago this year. Tim is grateful for the opportunity to be of service and is eager to learn more about how he can help people to take care of themselves in ways that matter most to them. Current priorities for the SHIBA program are to recruit and train more diverse volunteer advisors, enhance outreach to traditionally underserved communities, improve partnerships with organizations that support people with the greatest social and economic needs. In state government, Tim previously worked at the OIC, Labor and Industries, and Healthcare Authority in both PEBB and Medicaid divisions. Before his career in state government, Tim worked in several nonprofit organizations, including at-large insurance companies. Tim lives in Olympia with his beloved wife, Stephanie, and their cats, Arlo and Tucker. His hobbies include reading, walking, movies, and cooking for friends. We are also fortunate to have Larry Cole joining us today. Larry Cole has been a SHIBA volunteer since he turned 65 back in 2018. He helps mentor and train new volunteers and makes Medicare presentations to a variety of audiences and has helped to develop the King County Online Reference Library. He has a background in engineering, business and systems development, and artificial intelligence from 29 years at Boeing and 10 years as a mental health counselor at Sound. They both bring a wealth of knowledge to our topic today. Larry and I will be keeping an eye on the chat, so feel free to ask questions. It's all yours, Tim.
All right, thanks, Anita, and thank you, Larry. Let me see if I can manage my technology here. I feel like I'm not quite in the right place, so let me try once again. Pardon the interruption here. Okay, are we together now?
Yeah, Anita, we're seeing things great.
Okay, here we go then. Terrific. Thank you. It is honestly, it's a pleasure to be here with you all today, and I'm very excited to work with my friend Larry. Larry and I met shortly after I started in my job a little over 4 years ago, and have a sincere, deep respect and affection for him, and always love working with him. So we didn't rehearse, but we're going to try to share virtually the stage today. And we have 90 minutes. I have a lot of slides, but mainly that's so that you have something to take away from our program today. We want to have ample time for questions and answers. And I think I'm counting, round numbers, 30 people in the audience. So I think there should be ample time. And as Anita said, we would welcome your questions along the way. You don't have to wait until the end. So feel free to use the chat feature and send us a question or a note. And Larry's going to use the chat feature to share some resources as we go along the way. I was taking some notes when Anita did her introduction, and I think the space that we immediately overlap in terms of the 4 M's is the one about what matters. We're going to have a slide that says what we really care about is person-centered counseling. So we want to start with the person, not the problem, because everybody's experience of the Medicare program is unique to them, and everybody's healthcare needs, values, and preferences really need to drive that conversation or the consultation that we have with people. So it makes me happy to see that we share that ethic. So this is kind of the program that we worked out with Barbara and Anita. Then we're going to do a review for you about getting started with Medicare. A large majority of the calls that we get are from people who are getting started with Medicare. So we're going to talk about eligibility and enrollment, being on time matters, what is your entitlement to Medicare, and then as Barbara wrote in the program, the ABCDs of Medicare. So we'll talk about the 2 different systems of care and the 3 different kinds of markets that there are for the insurance. I guess open enrollment for us really is this surge of work. We experience about half of our workload during the annual Medicare open enrollment period in the fall. and we're actively planning for the next one. So we'll talk a bit about that and then share some resources for you, and then hopefully ample time for discussion as well. Larry, do you want to say hello and introduce yourself?
Yes. Hi, let me technologically challenged here.
You can't be technical. You're my tech guru.
Woo! All right. Yeah, I'm Larry Cole. I think Anita basically introduced my background there. I think the whole my whole experience as a SHIBA volunteer has been absolutely wonderful, and the ability to connect with people and help them work through what I call the Medicare maze is just a wonderful experience. Feel free to reach out to SHIBA anytime. Every volunteer I've ever talked to loves connecting with people, and we'd be very happy to help you.
Thank you. It's great to see you today, always. I live and work in Olympia, and Larry lives and works in Seattle, so we don't often get to see each other. So it's always a pleasure to connect again. This is my contact information. I'm the program manager for the SHIBA program. SHIBA is a part of the consumer protection mission of the Office of Insurance Commissioner, so I'm a state employed person. Uh, and let's talk a little bit about what SHIBA is. So SHIBA, of course, is an acronym. We are the statewide health insurance benefits advisors program. We've been around, as Anita said, for more than 45 years. And as hard as it is to imagine 45 years ago, a group of local volunteers in Stanwood, Washington, had this idea like, wow, Medicare is really complicated. It would be nice if people could get some help navigating that they didn't have to pay for. And so fast forward 45 years later, and here we are. And of course, the complexities have increased dramatically, and the consequences of choices matter much more, right? So in the context of geriatric healthcare and primary care for older people, what we've seen is that insurance now has just such a great deal to do with access and people's satisfaction with their healthcare and their ability to get the care that they need in a timely way. So what you definitely see reflected in the consultations that people like Larry have is that these feel to people like very high stakes decisions. So a lot of the work for us, besides being technically correct, is just to help people experience some sense of relief and a sense of agency that they're able to solve these problems, and that they know there are people in the world who care about them and want to be helpful. So this is just some of the kinds of things that we do, but we're really just generalists. It's just a full service sort of what's happening with you that we could possibly help you with. And as I said, we really are in the business of what we call person-centered counseling or trauma-informed counseling. So it's about starting with who is the person compared to sort of what is the nature of the situation. As Larry will tell you, or other experienced volunteers will tell you, two people with exactly the same technical problems, if you wrote it out on a piece of paper as a case study, we're going to find that that's a very different kinds of consultation just because of where they are at in their own journey and the assets that they bring to that conversation. So we're always about starting with the who, not the what. Okay, so let's talk about getting started with Medicare. So I'm this program into three parts at a high level. So who is eligible for Medicare? How do you get enrolled? There are three different kinds of enrollment periods for Medicare. So we talk about initial enrollment, special enrollment, and general enrollment. For some people, getting started is automatic. For some people, they have to take affirmative action to get enrolled. And then we'll talk about what literally is Medicare. When we say a person is entitled to Medicare, what are we talking about? What does that mean? So eligibility generally is you are either a U.S. citizen or you're a lawfully admitted permanent resident, so green card holder, and you are either age 65 or older, you're a younger disabled person, you have end-stage renal disease, or you have ALS. And this feels important because there is sort of a mythology about Medicare that Medicare is for older people. And of course, that's true, but about 15% of the population in Medicare are people under age 65. And the range of disabilities is very broad, including people with things like severe persistent mental illness. So it's just to give the idea that we're talking about the huge diversity of people. We have about 1.6 million people in Washington state that are currently enrolled in Medicare. So actually getting started in Medicare is managed by the Social Security Administration. So I'm showing you a picture of the Social Security Administration website and getting started with Medicare. As Anita said in her introductions, we are celebrating 60 years of Medicare. It was one of the Great Society programs that Lyndon Johnson's administration innovated. And the Medicare law literally amends the laws that gave us the Social Security Act back in the 1930s. And so Social Security really does the business of determining eligibility and is the place that you're going to get started. As with so many things these days, online is the path forward. There are alternatives, but online is the path forward for sure, most expedient. So besides determining eligibility, Social Security is going to decide whether or not you have a premium for Medicare Part A, what your premium is for Medicare Part B, and I'm going to introduce this expression called IRMA, the Income-Related Monthly Adjustment Amount, and Social Security administers this program called Extra Help, which is for relatively low-income people to pay a lower premium and lower out-of-pocket costs for Medicare Part D. And I promise I will explain what is A, what is B, what is C, what is D as we move through the program. But just to kind of level set, Social Security is doing the heavy lift about getting started in Medicare. So with regard to the initial enrollment period, the fundamental question for people is going to be whether or not you're going to be automatically enrolled. For some people, the question is, do I have to enroll or can I wait to sign up later without a penalty? And those two questions would be certainly in our top 10 most common questions that we get from people. So I'm hoping that by addressing them today, you can sort of be deputized to go out there and help some other people who have that question or potentially help your own self. So the question about working past age 65 becomes more and more common for a host of reasons, including that for people like me, I was 62 in April, I will not be eligible for a full Social Security retirement benefit until past age 65. So a lot of people are enjoying their work and finding it meaningful and rewarding, and they're going to want to continue to work past age 65. Even if they're not still working, they may want to wait to defer taking their Social Security benefit until age 70, for instance. So the first question is, at age 65, are you intending to let go of the job that you have now and the insurance that you have through your job? If you are, then we're going to suggest you should enroll during your initial enrollment period. If you're working for a large group employer like the state of Washington or Boeing, then you do have the opportunity to wait past age 65 until the time that you retire. You can use your special enrollment period and you won't be penalized for being late. So the question about whether you're going to be automatically enrolled or not depends upon whether you're already drawing your Social Security retirement benefit. If you are drawing your benefit when you reach age 65, Social Security is going to want to automatically enroll you. You may accept that or you may want to decline. But if you're not drawing your Social Security benefit at age 65, you will not be automatically enrolled and you need to take action to affirmatively enroll yourself. And again, I'm going to recommend to you do that online at the Social Security website. So the initial enrollment period is the 7-month long period that surrounds the month of your birthday. I'm an April 6th birthday, so I'm using mine as an example. The ideal situation is that you're going to enroll yourself into Medicare, or Social Security is going to automatically enroll you during the 90 days ahead of your 65 birthday month. If you do it ahead of time, that will be ideal because you will not have any break in coverage at all. You'll cruise right from your employer insurance into the Medicare program. You will still be on time as long as you enroll before the 7th month, in my example, July. But in that case, you potentially have a break in coverage and other bad consequences. So the goal would be enroll on time, ideally ahead of the start of your 65 birthday month. So again, if you're already drawing your Social Security benefit, Social Security is going to send you your red, white, and blue Medicare card. And if you're ready to start benefits then all you have to do is file that card away in a safe place, and your coverage will start on the first day of the month that you're age 65. If you're not drawing your Social Security benefit already, and I'm again going to encourage you to do this within that 90 days ahead of your 65th birthday, then you're going to need to affirmatively enroll yourself to start benefits. And you can start your Medicare benefit independently of your Social Security benefit. So you might decide to start your Medicare when you leave your job at age 65, but wait to collect your Social Security benefit until you're age 70, in which case, rather than them deducting the Part B premium from your check, you'll send a check to the Medicare agency to pay your premium. So for people who want to wait past age 65 because they're continuing to work and be covered by a group employer plan, then we have what we refer to as the special enrollment period. So the special enrollment period is a period that is 8 months long. It starts the first day of the month that you're no longer working and covered by a group plan. Again, what Tim and Larry are going to tell you is plan ahead, enroll before you leave work so that your Medicare coverage starts the first day of the month that you're no longer working. So again, you can wait up to 8 months and still be on time and not have a penalty, but there are other consequences for doing that we would like you to steer clear of. So plan ahead and enroll yourself into Medicare to start the first day of the month after your group coverage ends. So if you do decide to decline Medicare coverage for now, you're going to have to know that it's up to you later to take action to enroll yourself. So Medicare is going to send you your red, white, and blue card in the mail, and you're going to fill out the form that comes with the card to say, thanks, not right now, and decline your coverage, but now it's up to you. You will not be prompted again later to enroll. It's going to be your responsibility to make sure that you enroll on time. And as I said, being on time matters because there'll be a penalty for late enrollment and potentially a delay in getting started. So if you need to take action, again, Social Security website. I want to step out of the general into the specific for just a second, because this question does come up, especially with people like me who are working inside state government, and they have the option of what's called a high deductible health plan that has a health savings account attached to it. And this may not be in our top 10 questions, but it does come up. And considering today's audience, I had a feeling it might come up. So if you're a person who is enrolled in a high deductible health plan and you're making contributions to a health savings account, the IRS rules require that you can't have other insurance besides your high deductible health plan. And so, of course, we mean specifically Medicare insurance. So if you continue to work past age 65 and you take your Social Security retirement benefit, you're going to be automatically enrolled in Medicare Part A. And then that would cause problems for your high deductible health plan HSA arrangement. So if you're that person who's going to continue to work past age 65, you need to decline your Social Security benefit, or you need to let go of contributing to your health savings account. The tricky part here is that when you sign up for Medicare Part A, with either affirmatively or if they enroll you because you're drawing a cash benefit, there's a 6-month look back. So you potentially are looking at a penalty for contributions you made in the 6 months before you turned age 65 and let go of your HSA. So my note here is consult with an expert, someone who helps you with your taxes, but just be aware that the rules are different for people that have a high deductible health plan and a health savings account. When you get ready to then leave work and you're thinking about what to do with the money you accumulated in your HSA, again, the IRS is the controlling authority here. Some of the expenses you will have as a Medicare beneficiary qualify, for you to draw down your HSA account, and some don't. So in general, yes, you can use it to pay premiums and copays for Medicare Advantage plans, but no, you cannot use it to pay premiums for a Medicare supplement plan. And I will explain what a Medicare Advantage plan is and what a Medicare supplement plan is in just a second. A good resource in general for questions about Medicare is the Medicare Rights Center, and I'm including their website here, which they call Medicare Interactive. But the Medicare Rights Center is a terrific, neutral, unbiased resource. I have a very friendly website, so I like to just suggest them as a general outlet for people with questions about Medicare. Larry, let me give you a chance to hop in here and say anything, any messes that I made that you want to clean up, or anything you want to clarify about eligibility and enrollment before we get into the thicket that is Medicare benefits.
No, absolutely. Everything is just wonderful. There was a question, what is the high deductible health plan? I was going to answer it, but I'll boot it over to you.
Oh, no, please answer that one.
Okay. The high deductible health plan that Tim was talking about is the form of insurance that has a high deductible. In other words, you would pay the first chunk of medical expenses during the over the course of a year, but you can assist with the payment of that items by contributing to a healthcare account. And that has become a very popular with a lot of employers now when they work with their employer-provided insurance. Again, the point to remember with these high deductible health plans is that you have to stop. You and your employer have to stop making contributions to those 6 months before you enroll in Medicare. And since most people don't think about enrolling in Medicare 6 months before they actually do so, there are a lot of people who get tangled up with that. Thanks.
Yeah, thank you. That's a great question. So let's talk about what is this Medicare entitlement that we talk about. So there are lots of different expressions for this. So you will hear things like original Medicare, traditional Medicare, fee-for-service Medicare. I'm sure Larry has a long list of these kind of euphemisms that people have. But in general, what we mean when we talk about Medicare is Medicare Part A, Medicare Part B. So again, this is a program. You know, there are lots of modern critiques of the program, which I think are on point. But you know, hearkening back to the beginning of the program 60 years ago, the intention really was to create a program that would keep older people from becoming impoverished if they needed health care later in life. And it was really modeled on contemporary insurance of its time. So Medicare Part A is the hospital benefit or inpatient benefit. For most people, they do not pay a premium because they have been prepaying in the form of a tax on their earnings. So for instance, on my check, there's an amount that says this money is getting deducted from your check and deposited into the Part A trust fund so that later when I become Medicare eligible, I will not have a premium for that. So this is the conversation that you hear when people say Medicare is going to run out of money. What they mean is there will not be enough money in the trust fund. There's not enough money coming in from current workers like me to pay for current beneficiaries like Larry. That's a conversation for a different day, but just for context, that's what's going on. I'll just tell you, spoiler alert, it's going to be fine. Don't worry, it's going to be there to take care of you. Medicare Part B then is medical or outpatient. So think about doctor's bills. The monthly premium that a beneficiary pays is set to be 25% of the cost of the program. So the government is paying the other 75% of the cost of Medicare Part B. And so those funds are what we talk about, the entitlement, where it's not a thing that the Congress votes to authorize every year. It's automatically paid by the Treasury on behalf of Medicare beneficiaries. It goes up every year based on the forecast that the actuaries make about how much Medicare beneficiaries are going to cost in the year ahead. For calendar year 25, the standard premium is $185 a month. For trivia reasons, back in 1966, when we issued the first red, white, and blue Medicare card, the Part B monthly premium was $3 a month. So just to give you a sense of medical inflation in terms of the Medicare program, and starting with the advent of the Balanced Budget Act and the passage of the Medicare Modernization Act, now we have indexed the Medicare Part B premium to income. So some high income earners pay more than the standard Medicare Part B premium, and that was about creating some degree of fairness in the program. Because as we'll see that for some Medicare beneficiaries, that $185 a month is a significant, like a life-changing amount in terms of their income. So here's a sample, if you don't already have one, of what a red, white, and blue Medicare card looks like. Believe it or not, it was not that many years ago that we switched from printing people's social security numbers on their Medicare cards to using a randomized number. But this is what your red, white, and blue Medicare card will look like. So again, the point to make about Medicare is that it really is major medical insurance. So number one, it does not cover all medically needed services. And number two, when it does provide coverage, it typically is not going to pay 100% of the cost. So you will hear, the typical thing that you will hear is Medicare pays 80% of a doctor's office and the patient is responsible for the other 20%. So that kind of cost sharing takes the form of deductibles, co-insurances, co-pays. And again, people will critique the program for the things that it doesn't have that they wish that it has. They want to compare it to the insurance that they had when they were working. And as much as that's fair, it's also fair to appreciate that it was not designed to be comprehensive coverage. It was designed to keep you from becoming impoverished when you needed healthcare later in life. So famously not covered by Medicare, prescription drugs, eye exams, hearing aids, dental, and then acupuncture, chiropractic, massage, naturopathy, all the things that people are used to when they're working, and it feels abrupt when they get to Medicare, and it's not included in the package of benefits. So let me talk about those exception cases for the Medicare Part B premium. First, for our low-income people, we have this thing called the Medicare Savings Program. And I have a link here, and I know Larry's going to help out with some links. But essentially, the state will pay the Medicare Part B premium. The state will pay the $185 for low-income people or low-income couples. And this is really a life-saving program, and the volunteers spend a lot of time helping people get enrolled and stay enrolled in this program. So again, consider yourself deputized to go out there and have that conversation with people and get them signed up. For our higher income earners, then again, we have this thing called the income related monthly adjustment amount. Thinking about your income tax return that you filed back in April, this is based on your MAGI, modified adjusted gross income, right? So it's sort of a sliding scale. And your premium for Medicare Part B is based on the income tax return that you filed during the year, right? So in this example, the income tax return you filed in April of 2024 is what we're using to decide your premium for calendar year 2025. But of course, your tax return was based on your earnings from calendar year 2023, right? So effectively, there's a lag. So a lot of people may need to follow through. I'm going to show you the next slide and file an appeal because their income may have gone down substantially when they retired. And so you want to make sure that Social Security gets your Part B premium assessment right, and that it stays right so that anytime that you had a change of income, that they're keeping up with you and you're not paying too much for your Medicare Part B premium. So there's a standard Medicare Part B premium, and then there's help for low income people, and there's a surcharge for higher income earners, but we want to make sure that that surcharge reflects your current day reality, not your reality from 2 years ago. Okay, Larry, let me ask again, anything you want to add, subtract, multiply, divide here?
No, coming right along.
All right, how am I doing for time? I'm doing okay for time. I feel good about
You're
where I'm
doing
at.
good.
Okay, let me shift then to talking about we've kind of done the Part A, Part B. I've alluded to Medicare Part D. So let me see if we can just kind of march through A, B, C, D together so that we have kind of a working map of our working model of how Medicare works here. So because, as I said, Medicare really is like major medical insurance, almost everybody has other insurance in addition to Medicare. So this is just a graphic representation to say a lot of people continue with insurance that they got from the place they used to work at, right? So someone like Larry, who retired from Boeing, has access to benefits from Boeing. My mother is a surviving spouse. My father worked at DuPont for a number of years. People who work in state government have the option of continuing benefits through the Healthcare Authority PEB program. Retired teachers can join the Healthcare Authority PEB program. So a lot of people have the option of continuing benefits from the company or the union plan they used to have. A significant number of people are low income people with limited assets, and they qualify for Medicaid to be their second payer after Medicare. And this is way more people than people expect. And this is on the high side of 50% of our caseload in terms of people that we're helping. About another 20% have this kind of insurance called a Medicare supplement plan or a Medigap plan. And we're going to talk about that in just a second. And then the bulk of people have what we refer to as a Medicare Advantage plan. And what you will have been aware of from reading the headlines is a number more like 50%, right? You're reading that 50% of people have Medicare Advantage plans and that it's trending higher. And the way that we square that circle is that about half of people who have insurance from the place they used to work, they're in a Medicare Advantage plan, but they get it from the company that they used to work for. About half the people that have Medicaid insurance are also enrolled in Medicare Advantage plans, but they're enrolled through the state Medicaid program. So that's how we get to about 50% people in Medicare Advantage plans, is that there are people who have commercial market plans, and then there are people who have Medicaid or employer plans that also elected Medicare Advantage plans. So here's a representation then of what I just did pretty quickly there. So we're talking about group insurance plans as one market, commercial insurance plans as a second market, and Medicaid as a third market. Inside of Medicaid, then, I'm going to make the distinction between full benefit programs, which means that the state is actually paying the providers directly, compared to partial benefit programs, where with the support the beneficiary is getting is that the state is paying their premium, but the state's not involved in paying their providers. Most people are enrolled in the commercial market, and I'm going to spend most of my time for the balance of our time together talking about Medicare Advantage plans and Medicare supplement plans, because those are the two approaches that generally people need to choose when they're getting started and have the option later during open enrollment to reconsider. So this is a kind of cut and paste that I did out of the Medicare and You handbook. This is how they depict original Medicare on the one hand compared to Medicare Advantage on the other hand. So regardless of whether you choose original Medicare or Medicare Advantage, you retain your entitlement to your Medicare Part A, Medicare Part B benefits, that red, white, and blue card. On the original Medicare side, then, you have the option of buying prescription drug coverage through Medicare Part D. And for most people, then they're either going to have a Medicare supplement or a Medigap plan, or they're going to be enrolled in Medicaid, or they're going to have coverage from the place they used to work at. Alternatively, people can elect a Medicare Advantage plan, and this is where Medicare Part C comes from. Generally, we refer to Medicare Advantage, that system of care, as being Medicare Part C. So you still retain your red, white, and blue Medicare card. You're entitled to all the benefits of Medicare Part A and Medicare Part B that you would be in original Medicare. But these plans are consolidated plans. So they include prescription drug coverage, and they typically include extra benefits of the kind that we enumerated are excluded from Medicare. So we're talking about vision, dental, hearing, as well as lots of other supplemental benefits for things like transportation or food or other kinds of in-home support for people. So on the one hand, it's sort of like a la carte, and on the other hand, it's kind of like the prefix menu, right? I don't know how great that metaphor is, but that's kind of what makes sense to me. So here I'm saying, again, it's an either or, right? You're either on the original Medicare side or you're on the Medicare Advantage side, but it's not mix and match, right? These are exclusive systems of care. So you're either going to get original Medicare, your red, white, and blue card, and you're probably going to get a private Medicare Part D plan, and you likely have other insurance besides, again, Medicaid, the place you used to work, or a Medicare supplement plan. Alternatively, you're going to enroll in a Medicare Advantage plan where your benefits are consolidated through a contract with one insurance company, which is a private insurance company. So let me talk about commercial market insurance. Again, I'm talking about people who generally are not enrolled in an employer group plan and not enrolled in Medicaid. There are some exceptions. As I said, you can be enrolled in a group plan and have a supplement. You can be enrolled in a group plan and have a Medicare Advantage plan. So they're not exclusive in the way that the two systems of care are exclusive. But this, I think, will give you a general orientation to the kind of fundamental differences. So for a commercial market plan, a person who has original Medicare, then they have their red, white, and blue card from Medicare. They have a separate insurance contract with a Medicare Part D company for prescription drug coverage, and they have yet another separate contract with a private Medicare supplement plan. You'll also hear these referred to as Medigap plans, or we call them by their lettered plans, so you might hear Medicare Supplement Plan G. Alternatively, and again, these are exclusive systems, alternatively, a person is going to elect a Medicare Advantage plan. They're going to retain all of the benefits that they have through Medicare Part A and Part B, and now they have a contract with a private Medicare Advantage prescription drug plan to take care of all of the other benefits that are not included in Medicare that are so important and attractive to people, including these supplemental benefits. So having sort of navigated getting started, right, which means eligibility, enrollment, and choosing a system of care. So if you're currently working, the fundamental decision is, do I stay with my group or do I exit? If you're eligible for Medicaid, it's about getting connected and staying connected. For people that have the option of either original Medicare or Medicare Advantage, they're going to make those preliminary choices. And now comes the annual exercise about open enrollment. So let's talk about how open enrollment works. It's not easy. Let's just say that, okay? Unfortunately, because it's not easy and because we have generally like a low level of literacy about insurance in the general public, most people simply ignore the whole exercise, which is very unfortunate. So what we really want to do is try to like enable people to get off the sidelines and at least engage this conversation. As difficult as it is, we want you just to try to engage the conversation. So the good news is that there's great technology offered through Medicare. So at the Medicare.gov website, and Larry will plunk a note in the chat for you, Medicare has stood up this thing called the Medicare Plan Finder tool. And you can compare benefits for Medicare Part D plans, or you can compare benefits for Medicare Advantage plans. You can create an account for yourself so that you can understand what kind of coverage you currently have. And you can also, using your account, do things like see your Medicare summary notices so you don't have to wait until the end of the quarter. You can look online immediately. So it's a great tool for tracking charges that are being made in your name, if nothing else, to prevent against fraud. So I'm definitely sort of like proselytizing for the Medicare website, creating an account and using the Medicare Plan Finder tool. So in general, then, depending upon where you're currently situated when open enrollment happens, then this is a description of kind of what your options are. So if you're a person with a Medicare Part D plan, you can change the one you currently have to another one. If you're a person with a Medicare Advantage plan, you can switch to another different Medicare Advantage plan. If you're a person who enrolled in the original Medicare system of care, you can switch to the Medicare Advantage system of care. If you're a person who's currently in a Medicare Advantage plan, you can switch back to original Medicare, elect a Medicare supplement plan, and a Part D plan. So at a high level, open enrollment is about figuring out where you're at today, assessing what you like or don't like or what's changing about your plan for next year, and then deciding whether you want to take action, and then using the Medicare site and, of course, kind-hearted people like Larry to navigate making those changes. So I'm going to talk a little bit about each one of those changes in turn. If you're a person who's enrolled in Medicare, I hope this is helpful to you. If you're a person who's not enrolled in Medicare, I hope that you'll consider helping someone who is when open enrollment comes around, because too many people, and by too many people, I mean like 70% of people, there was a recent study by the Commonwealth Fund, 70% of people don't even open their mail and learn about what's changing for next year. So consequently, in January, people like me and Larry field hundreds of complaints about people that sound like, how come no one told me things were changing? Which is very difficult for people like me and Larry because, well, you probably were told, you probably just didn't engage. So consider yourself, again, deputized to help someone. If you're not enrolled, and if you are enrolled, I hope this gives you a head start on your experience of the fall. So if you currently have a Medicare Part D plan, remember these are privately managed plans. So Medicare, the federal government contracts with private companies to offer these prescription drug benefits. It's almost for sure that things are changing year to year that matter to you. So if it's not the premium that you're paying, it's likely going to be the formulary, it's going to be the network, it's going to be your copays. So if you have a Medicare Part D plan, we're encouraging you, just make sure it's still the best one for you, because it's almost a certainty that things you care about are changing. If you have a Medicare Advantage plan, things again are going to be changing. The significant difference between Medicare Advantage plans compared to Medicare supplement plans is that they are all organized around the idea that there's a network of providers that you are allowed to see or incentivized to see. And so changes in those networks or changes in the cost of things like specialty care compared to primary care happen all the time, as well as because these are integrated plans that include prescription drug benefits, it's, again, almost a certainty that things you care about are changing year over year. So it's not necessarily the case that we're going to say, give up the plan you have now and change to a different one, but it is 100% the case that we're saying, be aware of the changes so at least you're informed, you're not surprised or disappointed or bitter. And because these are private plans that contract with the federal government, there is also the possibility that your plan will be exiting for next year. It will no longer be available. And again, Larry and I had that experience during last year's open enrollment, where we had about 60,000 people in Washington who got a discontinue letter from their company saying, we've made a business decision not to continue to offer this plan in the place that you live. And that is, as you can imagine, super disruptive for people. And it can be very difficult to navigate. But again, the consequences of kind of sitting it out are way worse than the consequences of engaging the conversation. So again, the Medicare Plan Finder site is your great tool. And this is the sort of purpose in life, the raison d'etre for people like Larry, right? Okay, last kind of, third kind of change, is a person who has a Medicare supplement plan and they're enrolled in original Medicare and they want to switch to a Medicare Advantage plan. This happens a lot, and it's usually because people feel like the premiums for the Medicare supplement plans are no longer affordable, or they really are motivated by those extra benefits or supplemental benefits that the Medicare Advantage plans offer. So this is relatively straightforward. Again, go to the Medicare Plan Finder tool and look at what your options are. It's just, to be really candid, it's overwhelming. There probably are 50 different Medicare Advantage plans in King County this year. So it's not going to be easy necessarily to choose one. What Larry and I would say is your primary concern is make sure that your doctor whether it's your primary doctor or a specialty care doctor, is enrolled with the plan that you're thinking about moving to. You just absolutely do not want to risk continuity of care for yourself. So for sure, you can call the insurance company. You can rely on their website. But what Larry and I are going to tell you is also take that step to call the business office of the provider and just make sure that you can continue to not have your services interrupted. And then, because there is no automatic crossover, if you elect to switch from a Medicare supplement plan over to a Medicare Advantage plan, you have to cancel your Medicare supplement plan so that they do not continue to charge you for that. It will not be canceled automatically, but don't cancel until your new coverage starts. And then finally, and this is the one that's tricky, is for a person to switch from currently having a Medicare Advantage plan and switch back to original Medicare, purchase a Medicare supplement and a Medicare Part D plan. The reason that this is a little tricky is because the Medicare supplement plans have their own rules for what you're here referred to as medical underwriting. So except for a very narrow space when people first turn age 65, or a couple of exception cases, you will not have a guarantee to buy that policy. You will be subject to the company asking you questions about your recent health history and taking a decision to admit you or not. So again, speaking for Larry, what we're going to encourage you to do is start early, apply to several companies, and do not make a switch until you have a yes from a new company for a Medicare supplement plan for the year ahead before you switch to a new Part D plan, because enrolling in a Medicare Part D plan in and of itself will cancel your Medicare Advantage plan coverage. And so don't have one get canceled without having another one in place. So this transition can be a little bit tricky. So again, people like Larry are highly trained and very caring volunteers are happy to help you or someone that you care about navigate through that kind of wiggly passage there. I'm almost at the end. This is where Larry's going to help me out with principal resources, and then we're going to turn to questions and answers. So first, of course, I'm going to recommend the Medicare and You Handbook. All Medicare beneficiaries have the option of receiving this in the mail or online. You can find the current version online. It's a terrific resource, and I think it does a pretty good job of helping people get oriented to the Medicare program. This is where you can find it, and it is available in many other languages. It's much easier to see other languages online. It can be difficult to get one mailed to you, but it's not impossible. There are programs like ours in all 50 states and 4 territories. Generally, we call these Senior Health Insurance Assistance Programs or SHIP programs. So you can go to the SHIP website and find a program like ours in the state where someone you care about lives. So my mother, I say, Fran, she says, don't call me Fran. I say, Mom, there's a program like ours in South Carolina where you live. I know there is, but you never call and talk to me. I'm like, all right, let's talk about your insurance again. But there are programs like ours all over the country, and people answer the phone at 1-800-Medicare 24 hours a day, 7 days a week. I am a strong fan, as is Larry, of our local system of area agencies on aging and aging and disability resource centers. There is a great resource called the Elder Care Locator, so you can find help where you live locally or find help for someone who lives away from you. And all of these agencies sponsor what are called information and assistance or information and referral programs, and the staff are excellent, just excellent. And they can do things like help you navigate applying for the Medicare savings programs or helping direct you to people like Larry. And then this is, Larry, I think I don't have the link. This is meant to be the link for WashingtonConnection.org. And this is the portal to apply for public assistance benefits, including the Medicare Savings Program. It's relatively simple. Again, the stipulation would be that you have some high-speed internet access and basic facility for using the computer. But I think if you were working with someone like Larry, you could complete an application front to back in about 25 minutes. And it's absolutely worth applying because the worst that can happen is that you get turned down. And then finally, I'll just close by saying our agency is also in the business of helping people to prevent, detect, and report Medicare fraud. So we are the Senior Medicare Patrol Program in Washington State. It's sad to say that fraud happens. It's very difficult, to talk about older people being exploited or abused, but it does happen, including by providers and including by family members. And so if that were to happen, or if you suspected that was happening, we would absolutely want you to reach out to us through the Insurance Commissioner's website. If you're not sure, you can always send a complaint, and then we'll dispatch one of our staff or volunteers to help you investigate that. Of course, I have to make sort of a shameless pitch for more volunteers because we always need to have more people learning about this and kind of keep sort of the farm system. Larry needs someone to mentor so that he can be fully engaged. So if you're interested in becoming a volunteer, please reach out to me or reach out to Larry. And as I said at the outset, I am representing a small part of the consumer protection mission of the Office of Insurance Commissioner. So we can help you with other kinds of insurance needs or questions. And again, you can reach us at 562-6900 or through our website, which recently got redesigned and is very impressive. So I can absolutely commend it to you. Okay, that's what I've got, friends.
Thank you so much, Tim and
I'm
Larry.
remarkably on time, Larry. I'm always over, always.
Yeah, and we have Sarah Damson saying that she loves this information. Thank you.
Thank you for that.
Yeah.
I felt like I did that really fast, so I apologize if I did it too fast. And I think, Anita, you're going to make the slides and the recording available to people.
The slides and the recording will be available, and then Larry is also going to send out the full Word document of the links that he shared today. So we'll be able to post those as well. We do have, yeah, so clear and concise.
Oh, well,
Comment.
and please do fill out the survey. You heard Anita ask for the survey evaluation. I'm speaking for Larry. We absolutely do want your feedback, please.
Yes, and I will put that link in right now so that you have it.
And we really, I did it quickly because I really wanted to make sure there was ample time just for some unstructured conversations, questions and answers, whether you're an advocate or a caregiver or if it affects you personally. Larry and I would be happy to spend some time and do some questions and answers with you, please. And I'll just say, I'm going to plug, I don't know if you can see this on the camera. Do I have to do something with my background? What is happening with my background? Do you have
You
any idea what I'm doing?
unblur your background in the video section.
Goodness, let me figure out how to do that.
If you toggle
Okay.
down below, there you go.
How's that? Okay. You can see my work here in the background shoved on the wall. Okay, so here's this little deck of cards that a coworker gave me. It's called Go Wish, and I put a note in the chat. This clearly is not for everyone, but it's sort of a values clarification exercise. The intention is that you would use this, it's essentially a deck of cards, right, to have a conversation with somebody about, okay, as we navigate end of life issues together, what are the things that you care about the most? So back to your kind of 4Ms, Anita, and what matters. Again, appreciating these are super challenging conversations. I just found that this was a really clever resource for helping people. As Larry said, people generally don't plan ahead for anything, but especially not for Medicare or end of life care issues. No one imagines being disabled or having a debilitating condition, but I'll just recommend that to you. It was a lovely gift that I appreciated, and you might appreciate it.
Great resource. And we have a question here from Margaret is, what is required to help a client? I'm a health advocate and sometimes designated POA and sometimes not.
Mm-hmm. Do you want to help with that, Larry?
Yeah, I guess I would have a question for the question. What is required? Do you mean in terms of what kinds of training or what kinds of permission, legal
Mhm.
permission, or what kinds of extra organizations can we get involved? Can you tell me a little bit more about that, Margaret?
Mhm.
It says, know what kinds of legal permissions.
Oh, whoa. Um, so in terms of helping a client to navigate Medicare, uh, most of what I do as a volunteer, there's no special permission that's required. Heck of a lot of training, and Tim gives us plenty of learning opportunities as we go. Um, but as a volunteer, if I want to, for example, tap into some specific Medicare resources, um, that for that I need some forms that have to be filled out. As a volunteer, we go through a pretty intensive investigation by the state patrol, isn't it, Tim? To make sure that we're kosher folks. Um,
Criminal background check. Yep.
yep, absolutely. Um, and in general, uh, it, we're we're pretty carefully instructed to avoid certain kinds of things like helping people to enroll. There's a whole series of things that we use to protect ourselves from maintaining client confidential information. Those kinds of protections. Um, Anything else, Margaret? Am I answering your question?
I would add a couple of things, Larry, based on I don't do near as much counseling as you do, but I occasionally will help someone. Um, if you have a client that can speak in their own voice, then you can 100% call Medicare and they'll just talk with the three of you. So you don't need any paperwork to get general kinds of questions answered like that. Generally, that will also be the case with the health plan. So if they're enrolled in United Healthcare, Aetna, Humana, I'm trying not to single anybody out, and they're having a problem, as long as you're on the phone with them, so imagining it's me and Larry and Anita, she's gonna say I'm Anita from Aetna, and I'm gonna say I'm Tim from the Insurance Commissioner's Office. I'm a SHIBA volunteer. I have Larry with me, and as long as Larry will articulate, yes, Anita, it's okay to talk to Tim, then we're all set to go. Social Security, a bit more rigid. We're going to definitely need paperwork with those guys that you have to pre-file, and they have their own form, so they won't generally take someone else's forms. Um, you can have a bit of aggravation about that, but it is still feasible. But in general, you don't need to be an authorized representative or a POA or have a durable power of attorney. Mostly, if the client is able to articulate, most of the healthcare and social services agencies will talk with you as long as they can represent. Having said that, we have lots of clients that can't do that. And then it is very challenging. And then we are back to forms, paperwork, pre-filed, proofs of identity. But I think I'm probably describing like the 2%, not the 98%.
And in the
You
chat,
can go a long way.
here, there were some questions about whether or not there were SHIBA volunteers in Alaska, and there indeed are. And then there was a question as to whether SHIBA volunteers will go to the homes and to individuals with mobility issues or those who do not have the internet.
Right, that's challenging. I don't prefer the volunteers go to people's homes just for personal security issues. But we would absolutely go to like an assisted living facility or a nursing home, 100%, or meet people in a public place. And Larry is doing a great job today, but we can absolutely enable virtual options. So we do lots of counseling, like from your phone or your tablet, if getting out is an issue for you for mobility or other reasons. And then more typically, like if that's just impossible, and absolutely is, right? I mean, there are people for whom getting out for one reason or another, or technology is a barrier. then what we're typically going to do is lean on our friends at DSHS or the Healthcare Authority or Developmental Disability Administration and have them dispatch a person who's qualified, if not to counsel, then at least to, relay the information back and forth. So we would I'm thinking about if you live in Forks, then we're going to send my friend Susie, who works at the Area Agency on Aging, and she's going to come visit you at your home because they have, they have the systems in place to make safe home visits like that. So definitely that should not be a barrier. We have ways to accommodate that.
And it looks like there's a question about how many hours typically does it take to become a certified volunteer?
That's a good question. I mean, I think it varies a lot depending upon someone's personal professional background and motivation. But and this is sort of a friendly dispute in my team. Like I'm going to say 18 months, and my friend Noreen is going to say 6 months. So I'm more looking at someone. It's a very typical experience. And Larry, tell me if this is not your experience, but that I feel like you're ready before you feel like you're ready. I'm like, Anita, you're ready. Go. And you're like, no, I think maybe a couple of more days. And I'm like, no, you're right. That's very typical. Um, and I mean, Larry's been doing this for 107 years. He's been a volunteer, but he's still going to once a month send me a note and say, there's this case and I just don't know. So you should definitely not think the frontier is knowing everything because that's inconceivable. So I think 6 months, we do like a 20-hour basic training course. We have a monthly 90-minute continuing education course. There are authoritative resources like the Medicare website that we refer people to. But if you were just going to say clock hours for a person to be proficient, I'd probably say about 80. Including working with Larry, kind of sort of job shadow or mentor, right? So we would say, hey, Larry is making some calls or Larry is making some visits. You want to sit and listen, watch and learn, debrief before, after, and then he'll be kind of side by side with you while you do that, and then he'll kind of listen in. I put 60, 80 clock hours, right, Larry?
Mm-hmm. Yeah, and that's kind of the upfront involvement before you become a volunteer that makes your own or responds to your own requests. But every month, we'll go through maybe 4 or 5 hours of additional training on topics that we need to brush up on, things that change.
Mm-hmm. Having said that, I would say looking ahead to the next Medicare open enrollment in the fall, I think with the investment of 5 or 10 hours, you could help people dramatically much just with things like create a Medicare account or find your relevant documents or log in and use the plan finder tool to say, here's 3 plans that look like a reasonably good choice for you. Let's get you an appointment with a SHIBA volunteer. I think in 5 or 8 hours, you could help people a great deal. Does that ring true for you, Larry?
Yeah. Oh, yes, totally. And in fact, the material that's in chat today, if you want to save the chat, there's 3 little dots there. You just click on that and save chat. I'll also be putting it in a Microsoft Word document and getting that to Anita, so you'll all have that available. But just the links that we have will allow you to go get a bunch of material. It'll allow you to help your contacts a long way.
Mm-hmm.
So, Tim, you shared that I think it was about 70% of folks have not engaged. And I'm wondering what you and Larry and other volunteers, how do you get the word out? We have quite a few folks who are on the call who might be facilitating support groups. And do you have opportunities that you're able to come out into the community and be invited and speak at those events?
As many, I mean, it's probably, Anita, it's probably our number one challenge is just raising awareness. Mm-hmm. I think, please, Larry, say your perspective. My perspective is it's like people don't care until it's urgent, right? So they're just coasting along, and endless amount of outreach to 55-year-olds lands on deaf ears. It's not until they're right at the brink that they start paying attention. So, but I open to all kinds of ideas. We've tried all kinds of things. What seems to work the best is radio advertising. I don't know why, but that just works really good. We did a volunteer campaign in January where we literally just sent a piece of mail to people's houses and said, "How would you like to be a SHIBA volunteer?" and got 400 people. Um, why that works makes no sense to me, but it does. So I think we're just like open to anything, but we would take as many speaking engagements as we can. There's no group too small for us to talk with. Virtual is much easier, but we try to accommodate as many in-person speaking engagements as possible. How about for you, Larry?
Yeah, I make a lot of welcome to Medicare or getting started with Medicare presentations and open enrollment presentations. And every one of those presentations, we encourage people, hey, you've just gone through several hours of training here. You've probably done a whole bunch of research before you came to this presentation. Why don't you become a SHIBA volunteer? That's the way I got started.
Mm-hmm.
Went to a SHIBA presentation and talked to a SHIBA counselor and was recruited. So that's another way that we reach out and touch people and get volunteers.
And I think this year we're going to try, it's always just about trying something, right? So I wish I had something to share with you today, Anita, but I don't. But we're going to create a packet. I call Peachy, this kind of paper folder that has an inside left-right pocket.
Right.
Um, we're going to create a folder like that, and we're going to distribute it to all the libraries and senior centers in hopes that we can then drive traffic, right? So this is not real life, but the radio ad's going to say something like, hey, your local library or senior center has a packet that might be useful to you as you navigate Medicare open enrollment. So that's a kind of a thing that if you're a caregiver or you run a support group or you're part of a professional association or like that, and you'd like us to bulk ship things like that to you, or if there's other resources that would be helpful to you, and beyond us showing up, we would love to do that. I do remember a Peachy. I'm old. Remember, I was 62 in April. I don't feel old, but honestly, I'm old.
Well, thank you so much. I'm going to put our evaluation link one more time, just because we've had so much chat happening, but here's our evaluation link. And I will stay on for a little bit. And if you guys want to stay on, I'm certainly fine to do that.
Happy to stay.
Thank you.